In 2004, we launched Hope Through Healing Hands. Our mission then was to invest in programs at home and around the world that were dramatically improving the lives of families threatened by HIV/AIDS. Beneficiaries included TASO in Uganda, more formally known as the AIDS Service Organization, Samaritan's Purse Prescription for Hope Initiative, and Save the Children's far-reaching work in child and maternal health in Asia and Africa. Since then, our health mission has expanded, but the principle of investing strategically in programs that we personally know through direct, on-the-ground experience continues. Over the years, we've invested over $3 million with a primary focus in two areas: sustainable long-term development and humanitarian emergency relief. Our commitment to our donors is to achieve early, demonstrable results that are foundational for continued improvement in the future. We invest where we know we can make a difference. For example, in three of the most devastating natural disasters of the past decade, representing Hope Through Healing Hands, I personally was on the ground within days. On December 26, 2004, the Indian Ocean tsunami released the energy of 23,000 Hiroshima-caliber atomic bombs. 7 days later, I was in Sri Lanka, delivering medical supplies and water purification tablets. We hand-delivered critically needed monies from our Hope Through Healing Hands donors directly to indigenous organizations at the local level who could then respond immediately and effectively. That responsiveness is what makes us different. In 2005, we traveled to New Orleans 3 days after Katrina, the largest and costliest natural disaster in American history. We provided hands-on medical attention at evacuation sites, including the Louis Armstrong Airport and the Convention Center. And on January 12, 2010, the fifth deadliest earthquake of all time struck Haiti, killing 230,000 people and injuring another 300,000. Within 4 days, I was in the operating room doing surgery just outside Port-au-Prince. At Hope Through Healing Hands, we specialize in personally and quickly getting to know the needs of people on the ground, partnering with those delivering quality care, and then deploying investments that lead to sustainable recovery. Yes, disasters happen, but prevention and building sustainable healthcare systems not only prepare communities to better respond when they do occur, but also lead to healthier, more fulfilling, and more productive lives for all people. That's why in 2009 we made a commitment at the Clinton Global Initiative to support and grow our Global Health Leaders program. This program enhances the training of health workers around the world and builds much-needed human capital. Simple health services performed by medical, nursing, and public health students save the lives of infants, children, and families. Global Health Leader Kelly Tashida, a student at Vanderbilt School of Nursing, traveled to Bugesera, Rwanda to work at the Neomata Hospital. While there, he identified the need to reduce patient-to-patient infections. He innovatively developed an affordable hand sanitizer that nurses could apply between patient visits. Infections fell. Care improved. Kelly cared for over 1,500 patients and trained over 55 staff while there. Kelly made a lasting difference. Another great global health leader is neonatologist fellow Amelia Wood. Amelia trained over 25 staff at Kajabi Hospital in rural Kenya, teaching nurses how to save the lives of infants through a few simple techniques in the absence of a doctor. She cared for over 550 patients during her stay, and her training will likely save the lives of hundreds of newborns in the future. And East Tennessee State University's College of Public Health student Brittany Cannon spent the summer in Roatan, Honduras. There, she educated over 500 kids about dental hygiene and touched the lives of over 1,800 people, improving the health of a community in Honduras. Her legacy continues long after her departure. Whether as individuals called to action, community leaders, or national policy, working to improve the health of others wherever they are in the world sends a powerful message that speaks to the oneness of humanity. At Hope Through Healing Hands, we have witnessed the power of promoting health as a currency for peace. Health diplomacy allows us to open our hearts to the rest of the world and to nurture the common interest and values that bind us together as human beings so that the next generation will inherit a safer and better world. Medicine and health truly become a powerful currency for peace and understanding. Our work at Hope Through Healing Hands is made possible entirely by private donations from those who want to be a part of something bigger than themselves. Your dollars go to stimulate global health and investment in community health workers, young healthcare professionals, and ultimately American health diplomacy. We hope you will join us. Your investment will bring hope through healing hands.